Hey guys, Dr. P here today, and in this video we're going to be showing you some of the things that chiropractic can do for women who are pregnant. So we have Paula here who's volunteered to share some of her experience. So Paula, tell the viewers, how many weeks down the road are you?
Almost 30.
30 weeks, okay. So you actually, now you had been to a chiropractor previous to me, of course.
Yes.
But then you started care with me shortly after you became pregnant. So what could you say that chiropractic care has done for you in terms of your body and comfort as you've gone through this, as you go through this pregnancy?
Definitely has helped my mobility, has helped me to go through the changes that my hips are going through, and overall just better sleep, a lot more comfortable. Great.
So you know about this stuff because you can tell the viewers you're a massage therapist, right? So, and we talked about how and we'll show this in a little later in the video, but part of being pregnant is a change in the center of mass of the body. So it moves to the front as the belly grows to the front, and that can we get compensation with muscles in the back starting to pull to keep you from going forward. And so, because you have had some SI joint and hip discomfort at times during this pregnancy, right?
Yes.
I know that's one of the things what do you find that when you come in that situation, because your body's changing so quickly, how have the adjustments been able to help with that?
Definite release.
Yeah.
Relief.
And what do you find in terms of how long does that typically last for?
I enjoy coming once a week.
Yeah, once a week. Okay, so, and we'll see. I've seen, typically if someone's a regular patient and they're pregnant, we might see them on their schedule that they were coming before. It might be once a week, once every 2 weeks, once a month. As we get into the last trimester, often we're seeing women twice a week because your body's there's a lot of changes happening. There's a lot of extra stresses on the body. And if we can keep you from not being uncomfortable, being able to walk, being able to continue working, not being up all night with pain, neck pain, headaches, back pain, then we really want to support you so that you can do that. So anything else you want to mention to the viewers before we show them some adjustments?
I think you've covered it.
Okay, here we go. So one of the first challenges we have with our pregnant patients is even getting them on the chiropractic table. Luckily, we have this one here in the office that has some special modifications. So we're gonna raise the pelvic piece, and Paula knows how to get on there. She's gonna bring that. This is a special chiropractic pregnancy pillow. So she'll get in position, and this table will lower, we can lower it. So it gives her a really easy, comfortable way to get into position, to check the spine, check the hips, without a lot of difficulty, especially as you're getting further on in pregnancy. So now we have our pregnant patient lying face down, and we can check their spine the way we would with a regular patient. So that is by palpating the spinal segments, seeing how they're moving, checking for tenderness. In pregnancy, we're definitely going to key into the lower back, SI joints, and hips, as those can be really tender and tight areas, especially later in pregnancy. So Paula, as I check you here, any tenderness right here, right SI joint?
I'm okay then.
You're okay there? How about on the left side?
Tenderness.
A little tender there. How about as we check into the glutes and piriformis? Right side?
A bit tender.
How about left side?
More tender.
Great, we're gonna do some work there. So one way we can address the SI joint in the hip is with the patient in the prone position. So I can use my thumb or elbow to do some trigger point work on the glute medius, on the piriformis muscles, which can give a lot of relief to low back and hips. And then we can, with this table, do a drop piece adjustment on the SI joint. So we're gonna demonstrate that right now. So the table piece will come up, and it's just a drop through and a drop through. So another way we can address lower back, SI joint, and hips is with the patient in the side lying position. So we have lots of space for the belly and the baby in this position. Again, I can come onto the posterior part of the hip and do some work on these gluteals and piriformis muscles. And if we want to do a standard SI joint or lumbar adjustment, we can certainly do that with with a pregnant patient, we don't have to rotate a lot. We can just, chiropractor can come on top, make a contact, and push through and deliver an adjustment. So you mentioned, Paula, where are you feeling some discomfort this week?
Just below the neck.
Just below your neck. Okay, so we're gonna check that. Right there? Okay. Let's take care of that. Breath in, let it out. Great. Have you had any headaches during your pregnancy, Paula? Or neck pain?
Not really, but definite neck pain.
Neck pain, okay. So let's check you today. Tender there?
Mm-hmm.
Okay. Okay, good. So now that we've got our pregnant patient adjusted, we can let the table do the work to get them up. All right, how was that, Paula?
Fantastic.
Great. Well, you got to take a look at what chiropractic can do for women who are pregnant. Thanks so much for watching our video. If you enjoyed this, be sure to like and subscribe, as we've got more great